Welcome to Clear Minds. What if the story we've been told that addiction is a moral failing is completely wrong? What if it's not about willpower, but a response to a wound you can't even see? Millions of people are trapped in a cycle of dependency, their struggles dismissed as a lack of character. But science tells us a very different story. Today, we're exploring the powerful link between trauma and addiction. We'll break down how the past can literally change the brain, and most importantly, talk about the path to real healing. Because understanding why is the first step to changing how. For decades, we viewed addiction as a simple choice, but that misses the fundamental question. What drives that choice in the first place? The answer is often buried in the past. Addiction rarely happens in a vacuum. It grows in the soil of unhealed pain. To understand why, we have to look at the brain. Think of our brain's threat detector, the amygdala, as a sensitive smoke alarm. After trauma, that alarm gets stuck in the on position. It starts blaring out for burnt toast or a little steam, flooding your body with stress hormones. This constant state of high alert makes it nearly impossible for the rational part of your brain, the prefrontal cortex, to think clearly, manage emotions, or make logical choices. The brain is physically rewired for survival, creating an internal world of nonstop chaos. Now, imagine living inside that rewired brain with alarms constantly ringing. What would you do for a moment of peace? This is where self medication begins. People often use substances not to get high, but to get relief, to turn off the alarm, even for a little while. But this relief comes at a cost. Substances flood the brain with a tidal wave of dopamine that rewires its reward system. Soon, the brain believes it needs the tidal wave just to feel normal. This creates a vicious cycle. Trauma creates pain, the substance temporarily relieves the pain, and the brain craves the substance as the only solution. This cycle often starts in childhood. The landmark ACE study, or Adverse Childhood Experiences, found that a person with 4 or more traumatic events in their youth is 7 times more likely to develop an alcohol use disorder. The addiction itself then creates new trauma, from the anxiety of withdrawal to the shame of dependency, pulling a person deeper into the cycle. So, if trauma and addiction are this connected, what's the solution? Trying to treat substance use without addressing the underlying trauma is like bailing water from a sinking boat without patching the hole. The water will just keep coming in. This is why trauma-informed care is the new gold standard. Integrated approaches that treat both the addiction and the trauma at the same time have far better outcomes. Therapies like trauma-focused CBT and EMDR help process traumatic memories and create a new foundation of safety and self-regulation. The goal isn't to just stop a behavior, it's to heal the wound so the substance is no longer needed to stay afloat. Healing means changing your past's relationship with your present. Let's go back to our first question. Is addiction a choice? For millions, it's a deeply ingrained response to unbearable pain. Science shows us that trauma physically rewires the brain, setting the stage for dependency. But understanding this opens the door to a more compassionate and effective path to recovery. What's one thought this video sparked for you? Share it in the comments below. It helps all of us to feel a little less alone. And if you or someone you know is struggling, we'll leave resources that can help you in the description. Your past does not have to define your future.